Don't look at the camera. Hi, I'm Michelle, and I will be working with you for the next few weeks. What's your name?
Ashley.
What's your last name?
Gilmore.
And how old are you?
I'm 19.
So why do you think that you're coming into therapy?
I am very unhappy at most times, and then I get very deep mood swings, go up and down.
Yeah. So I just have a few questions just about like your family and just like the history of your symptoms and stuff. So I guess just bear with me. So who do you live with right now?
I live alone right now.
You live alone. How old are you?
I'm 19.
Okay. So are you in contact with your parents, or like how is your relationship with your parents?
They live cross country, so.
Okay. And are your parents together?
Yes, they are.
Okay, cool. How often do you speak with them?
I speak with them on a daily basis.
That's good. Do you feel like they're supportive of you?
Yes.
Okay, that's really good. And just like to get some demographic information from you. So obviously you're Caucasian, correct?
See.
And your parents, they're married. What do they do for work?
My dad's an engineer, my mom's a nurse.
So you'd say that you've been pretty well off for most of your life. Okay, that's good. So you're presenting symptoms of like very high moods and very low moods. So like kind of like, would you say like manic symptoms sometimes? Like you feel like really kind of like energized, like you don't have to sleep a lot, and even if you don't sleep, you still have energy, and like you kind of feel it's almost like a euphoric way, like you feel like you're on the top of the world, kind of. Do you feel that way sometimes?
And at times, yes, and then
other times you feel low?
Other times I feel very low and sleeping.
And you sleep a lot?
I do sleep a lot, yeah.
Do you sometimes feel like you can't get out of bed?
Yes.
A lot of the times, people that feel like depressed like that, they'll stay in bed a lot, but they won't actually like sleep. Do you sometimes like
I'll just like go on
just
my
lay
phone,
there and go on your phone and like
just but like I just physically can't get out of bed. It's just
yeah. So how long have you felt this way? Or been feeling the symptoms?
I'd say a few years.
Yeah. So when did you graduate? Did you graduate high school?
Yes, I did. 2011.
Okay. So would you say that your symptoms may have started around that time?
It started like next to my junior year of high school.
Okay. And at that point, you lived with your parents, correct?
Yes.
And do you feel like when you were living with them that support kind of helped you, or do you feel like that was had nothing to do with it?
Yes, I believe like when we were with my parents, my mom maybe don't do things. And
motivated you a little bit.
Yeah.
Do you sometimes feel like if you had more motivation, this depression or the depressive side of your mood would be like a little easier to cope with? Okay.
Or if I had something to do, like I need to have something to do during the day.
Yeah. So what do you do? So when you feel depressed, is there something that you do to treat yourself? Like would you like maybe get a coffee, or like what do you do when you feel the depressive symptoms?
I usually, try to hang out with someone, like, see a friend, or go out, get a coffee, or go do something that makes me feel happy.
Yeah, that's good. Okay, and then hold on. So the other side of the spectrum, you have the manic symptoms. So what do you do when you feel really hyper? You feel energized. You feel like you're on top of the world. You feel very up and you feel highly of yourself. Is there something that you do to treat yourself then? Like, do you use drugs at all to calm yourself down?
Recreational smoke marijuana.
So you smoke marijuana recreation?
Yeah.
Okay. And we'll get to the substance abuse thing a little later, but I just want to know what you do to treat yourself when you're feeling symptoms. Is there any ritual you perform? Is there any self-treatment that you do for when you feel a certain way?
When I feel sad, I try to get out. And then when I am, on a high, I kind of just I don't really do anything. I don't know really what to do. So.
Yeah. When you're feeling manic, you think? Okay. So yeah, that's probably something we could work on if you're willing to. Okay, so I guess I do. Okay. I guess I do want to ask you a little bit about substance use and substance abuse. Do you know the difference between the two? Between substance use and substance abuse?
Somewhat.
Okay, so a lot of people use substances. So if I drink on the weekends, but it doesn't affect my life activities. Like, so say I go out with my friends and I have a few beers at the bar, and I get in a cab and go home, go to sleep, and I'm fine. That would be using because I'm using it. It's not interfering with my life. If I am drinking on the weekends, even if it's only on the weekends, if I'm drinking on the weekends and I have a few beers, same amount maybe, go out and get into a bar fight and lose my children in a custody battle, that would be an abuse because it's affecting me socially, it's affecting my relationships with the people that I love and that I'm close with. So in that case, do you use substances? You said you use marijuana. Are there any other drugs you use now?
Besides alcohol.
Is alcohol? Okay. How often would you say you drink?
On the weekends.
Okay. How often would you say, or how many drinks would you have on a typical weekend night? And just try to speak up a little bit, just so I can hear you better.
Probably maybe I'd say 3 to 4 drinks.
Okay. All right. So just so you know, heavy drinking is considered they're 5 over a period of the month, 5 times drinking more than 5 drinks. So say you go out every weekend and for 2 nights out of the weekend you drink 5 drinks. So that would be 8 nights in a month, 2 for each weekend, and you drink 5 drinks. That would be considered heavy drinking. And then binge drinking is considered, it's over 4 drinks in an hour, I think it is, or over 4 drinks in one sitting. So, I mean, but that's common among college students, I feel like. Yeah. Are there any other substances you're using? And you can be honest if you've tried anything or anything. I'm not judging you, don't worry.
Well, I've tried Molly.
You tried? Okay. Yeah, I've definitely seen that becoming a little more popular these days, I think. All right. Has using any of those substances interfered with your life negatively?
No. At least I see it. Really.
That's it. Okay.
I don't feed for anything. I don't want to be like, oh my gosh, I need this.
Yeah. All right, hold on one second. I'm just going to turn this fan off real quick because I think it may help us with hearing each other. All right. That's probably better. I should have done it earlier. Okay. Do you have any history of mental illness in your family? Going back, even to your grandparents, relatives.
Nothing diagnosed, but there's obviously, I think, or I wouldn't have been told. It's not, mental illness isn't something that my family really shares. Even if they do have it, they wouldn't be told. So.
Yeah. Okay. Do you feel like maybe that's because of stigmas attached to it?
I definitely think so.
Yeah. Okay. What was I gonna say? What about medical history in your family? What are any physical disabilities?
Besides, I guess Crohn's disease.
Okay.
Runs in my family, and I think and then skin cancer runs in my family.
Okay. All right. And then with you, have you had any surgeries or anything relevant you feel like you should tell me relating to your medical history?
I think that would really impact my life that much.
Yeah. Did you say, I thought in the intake form or in the form you filled out in the waiting room, it said that you had knee surgery?
Oh, yes.
You had knee surgery? Okay. So could you tell me what happened with that a little bit?
It was a lacrosse game and I hurt my knee very badly, so.
And were you prescribed any medication after your surgery?
Just after the surgery, just Vicodin.
Vicodin?
Yeah.
Did you feel like you had a difficult time stopping the Vicodin? Did you only use
I
it for
honestly couldn't
pain?
even handle it in my stomach. They had to switch me from Percocets to Vicodin.
Okay.
Just because, and I could only take honestly, I wanted to be off it as soon as possible. I did not feel any high or anything. It was
because a lot of people do experience a high, and that can be difficult.
Like, apparently, according to my mother, and I was very loopy, but I never felt it. Like, I just felt like dead to the world, and I just wanted to know when I could drive again.
Okay, well, I'm trying to think. Can you tell me what medications you've been prescribed, or what medications you're currently taking? And that can be anything from like ibuprofen, vitamins, any medications you take on a regular basis.
It would be, the birth control pills.
And what are you on for birth control?
I'm not quite sure.
Is it a progesterone?
Yeah, it's a higher estrogen one.
High estrogen? Okay.
Yeah.
Usually they can
It's like a 10
Usually they combine that with a progesterone.
Yeah. And then Flonase.
Flonase, yep. And do you take any like NSAIDs or anything like on a regular basis, like an ibuprofen or like a painkiller?
On occasion when period pain, stuff like that, I'll
so
take ibuprofen.
Yeah. All right. Let's see what can we go to next. All right. So before we do any informed consent thing, I just want to know like what your goals of treatment are. And do you have anything you'd really like to accomplish through this? Like, what would you like?
I would just like to kind of have not so much. It's just the uncertainty of my days. Kind of. I just wish that I would have more focus on what I need to do.
Maybe like stability.
Yeah.
Do you feel like you want to use a therapist such as myself as like a way for you to release, to release emotion, to have someone to talk to, like a friend sort of,
That'd be
someone
great.
you can talk to? That's good. Are you looking to possibly get a diagnosis? Would you like
It
to
would be nice to
know what's going on?
kind of put that to rest, the uncertainty of it.
Do you think that it would affect your relationship with your family?
I would maybe hope that it would be an inspiration to them.
Yeah.
Maybe, if there's something wrong, to be more open about it. Because, it's nothing to run away from. It's nothing to be ashamed of.
It's very true. So, I obviously have to get to talk to you a little more to know, what the right type of treatment is for you. But I'm kind of seeing that maybe something I don't want to start you with medication or anything, quite yet. But I do definitely want to talk to you more and just figure out a little bit more how you're feeling and stuff, because I feel like you do need someone to talk to in this time in your life, and I think that seeing you for the next few weeks or months would be very helpful. But of course, we'd have to see what your insurance covers as well. So, alrighty, just trying to figure out what we have to do here. Alright, so I'm just going to explain a little bit to you about what informed consent is. And basically it just has a few different parts. I'll introduce it, and then you'll only be eligible for certain services according to your insurance plan as well as our institution. California State University in Northridge. It depends on what we can offer you. As a school, we may not be able to offer the same services as a private institution. So usually we do services for 8 sessions for an academic year. If that's not enough for you, we could refer you to a psychologist or maybe even a psychiatrist. I would say a psychologist first in the area. But yeah, and then so the next part would be, so after we figure out what you're eligible for, I would explain to you the nature of the counseling and a little bit about the counseling staff that we have here at the school, and confidentiality, that's a really important part, so I'll get to that. Also making sure that you actually attend the meetings, talk about the no-show policy, about conflicts of interest, about if you have to leave school for medical reasons, what that entails. This is not mandated counseling, so you're not required to be here. And my contact information. So, yeah. So you can look at this. Let's look at this together so I can read over it a little bit with you.
Okay.
So first part would be just welcoming you to the university services. And this document is just going to tell you what counseling entails, and basically it's going to ask you if you agree with what it's saying, and then if you do agree at the end, you sign it. But it's definitely important that we go over this. So you have to be a student in order to receive counseling here, which you are, correct? Okay. So you're a student here. That's the first thing. Okay, so that's pretty much if you are a student and your status is a currently enrolled student, you basically are eligible to receive counseling here.
Okay.
So you are. And so we offer 8 sessions per academic year. So if you want to stay here for 8 sessions, you're welcome to. And then after that, I guess we could refer you to a nearby psychologist.
Okay.
And from what I'm hearing, I kind of feel like we should maybe while we're doing these sessions, maybe I could try to find someone for you to continue therapy with after those 8 weeks, because you definitely need someone to talk to for a little longer, I would say. Okay, so let's do this. We do offer psychiatric consultation and treatment, so you can receive medication if you were to choose to go that route. We offer group counseling and workshops and referral, like I said, to other psychologists. And we ensure that we will work with you to the best of our abilities and to meet your needs. And the nature of counseling is just there are risks and benefits associated with this, far more benefits than risks. This is not a very experimental type of counseling. It would just be, mostly cognitive behavioral, but you probably start off just to figure out what kind of counseling you need. So just a few sessions of just talking. It says that counseling may improve your ability to relate with others, and it would actually provide clear understanding of yourself, your values, and your goals, which sounds like something that you may need at this point. And our counseling staff, we're all licensed psychologists, and we are licensed marriage and family therapists, psychiatrists, and psychiatric residents, so some students, with medical students, and licensed clinical social workers, postdoctoral psychology interns, and pre-doctoral psychology interns. So basically everyone here is certified and has the credentials to be working with you as a patient.
Great.
So you're in great care. And then, this is definitely a big one. Confidentiality. Let's do this. Everything you say will remain in confidence with me and my support staff, because some things are necessary that I share with them, but it would be talk among psychiatrists and psychologists. No, your files would not be shown to anyone. You're an adult. Your files would not be shown to your parents unless you give permission to. Would not be shown to friends, anyone. It would just be, if I had to refer you to another psychologist, I would give them your file. That's the only way your information would be shared whatsoever. And then right here, I just want you to read this real quick. I understand that no records or information about me will be released from UCS without my permission, except under these circumstances. And if you could actually, why don't you just read those out loud,
Okay.
just so we have them.
If I present a serious danger to myself or another person, if I was abused physically or sexually or neglected as a child, or if any other minor children are currently at risk of being abused or neglected by persons who abuse me. If I'm 18 years of age and disclose abuse or neglect to my counselor. If UCS learns that an elderly person, dependent adult, or minor child is being abused or neglected. If I have physically or sexually abused as a minor child. No, if I have physically or sexually abused a minor child, and that child or minor children are at risk of ongoing abuse, if a valid subpoena is issued for my subpoena, if a valid subpoena is issued for my records, or my records are otherwise subject to a court order or legal process requiring disclosure.
Okay, so pretty much.
I never knew how to spell subpoena.
So pretty much your records are going to be safe. No one's going to be reading your records. So I just want you to know that everything you tell me is in confidence, and that I'm not sharing your information with anyone.
Okay.
All right, and so the attendance policy, while you're seeing me, you're expected to show up, just because, you do only have 8 sessions with me as a therapist, and just if you do have to miss a session, just make sure you cancel at least 24 hours before your appointment. You know that. Okay, so then the no-show policy. Currently, the UCS has a 24-hour appointment cancellation policy, which I just described to you. If you no-show for your appointment 2 times, you may lose your privilege to see a counselor. So, just make sure you call. And also, it's really important that you do show up. It will benefit you so much to be at every session. And sometimes, it will benefit you. And, I don't want you, there's this thing called resistance, and it's just sometimes people tend to not show up to appointments for other reasons. If you're starting to feel like that you're overwhelmed by therapy, and you might not want to continue it, just let me know. But it will benefit you to show up. All right, and then conflict of interest. So I just want you to read this real quick. I understand that graduate students who plan to apply for internships or graduate assistantships at UCS are discouraged from receiving individual or group therapy. So if you're trying to apply for an internship in this office, if you're are you a psychology major?
I'm not.
Okay, so say you were a psychology major and you wanted to apply for an internship, it wouldn't be best that you seek counseling from us, but that's okay. So, and medical withdrawals. So just if you do have to miss counseling or you're missing school, I just want to let you know that you can, we as an office cannot, we can't vouch for psychological distress. So say you were to miss class and you miss an exam, our office can't write letters saying, oh, well, this person, you as a patient, is under great psychological distress. We can't write letters to you saying that. So say if you have a physical medical problem and you see a doctor, he can write a doctor's note saying this person.
But you're not a health.
But I can't do that. We can't do that as an office because that we're not allowed to do that. Yeah. And then so you're not mandated. You're here for your own purposes. Yeah. And then your records, I just want to tell you a little bit about how your records will be stored. Your records will be stored electronically and include information you provided and information about any interactions, counseling, phone calls, consultation emails, etc. with UCS. The information is only accessible within UCS and is protected by multiple security measures. All UCS employees sign confidentiality agreements. This information is separate from your academic records.
Okay.
So anything you say here will not affect you whatsoever academically. And I just want to ensure your safety with that. If you tell me that you cheated on a test, that has nothing to do with your academic records. We're not going to tell your professors that you cheated.
Okay.
Because everything you say, is separate from those records. And contacting me, I can give you my cell phone and my email, and I'll write that down for you on a card when we're finished here. But my name is Michelle Corsetti, and I work for this counseling office. And I have some information to fill out here, and I would like you to write your cell phone number, if you do have a residential phone, your email address, and an emergency contact, just so if I do have to reach you, that would be the easiest way to do that. Say I have to cancel for some reason or something like that. Okay, so what else would I do? So maybe you could just, well, first of all, do you agree with everything you see?
Yes, I do.
Do you want to read it over again, or do you feel like you kind of understand it?
You went over it quite well. So.
Okay, so I guess just fill out your information. Here, actually, I got a pen here. There you go. And so you just put your last name on the first line. What year are you graduating in?
I am graduating in 2015.
That's awesome. And what's your major?
My major is education.
Very nice. Secondary or elementary?
Secondary.
Cool. And initial there? Did you said secondary, right?
Yes.
So you're dual majoring, technically, right?
Yes.
So what do you want to teach?
I want to teach world history.
That is awesome. Okay, so then, so that is for your cell phone number. And if you do have a residential phone, it doesn't matter. But, and then email address. And then just other phone, I would just put a contact and a number. And yeah, just check yes for wherever you filled out a line. Yeah, perfect. All right, and then this is giving consent. So yeah, I guess just read that out loud, just so we both
I
hear.
certify that I've read, understand, and agree to abide by the information outlined by above regarding my eligibility and use of University Counseling Service. I hereby give my consent to authorize the University Counseling Service to evaluate, treat, and/or refer me to others as needed. I've had the opportunity to discuss my questions regarding the above information.
Okay. So if you agree with that, then you may sign, and we would start our next session. We'll probably figure out what kind of care you need, as well as if you would like to be referred. And obviously, I'd learn more about you at the next session. So, is there anything else we should go over right now? I will make a copy of this, and I will give you a copy when I go out to the office. And maybe what we could do is just maybe like outline a little treatment plan, just for so we have 8 sessions, and this counts as one.
Okay.
So you said that you would like, okay, actually, let's make a little list of goals. How about that?
All right.
Just so we can finish this out. So you said you want to gain stability. Right?
Yes.
And how do you think that you would go about doing that? What are some mini goals you think?
Maybe
Little things that maybe we can work on.
Have set times where I can study. Have set times for, maybe get a job that I can go during those times where that gray area between after you get out of school.
Like a part-time afternoon.
Yeah, just something light, just to keep myself busy. If I notice when I keep myself busy, when I have things that I have to get done, or when I obviously, I love to spend time with my friends and everything.
Yeah.
But it's during the day when I have stuff to do.
What about a hobby or something?
A hobby, anything. Just
Okay.
maybe play lacrosse again. Go on weekends.
Sports. Yeah, that's a good idea.
When I have things to do, I feel normal. I don't feel.
Okay, that makes very, very good sense. So how about our first goal? Just provisional, gain stability. So do you think that doing these things would help with your symptoms of your highs and your lows?
It actually did help, because I actually once my parents left, and I kind of actually once, I have to say once after my knee surgery, I kind of lost my way a little bit. I'm not quite sure. I used to be so busy, so active, and it didn't really affect me until I actually had, more free time that I could use for my own good.
Yeah. Okay, so we'll gain stability. That's a really good one. Set up a routine. That would definitely help with your symptoms. And I do want you. I'm going to write down my phone number and my email. I'm going to actually write down a number of a psychiatrist we have here. And because I'm not certified to talk to you about medication, so I would you could talk to her. Do you have a preference for a female or male doctor?
Probably a female.
Okay, so yeah, we talk about medication. I don't know how you feel about that. I don't know if that's really the best option for you, but I'd like to get to know you, and so definitely a goal would be gain stability. Do you feel like you can kind of control your symptoms, or do you feel out of control with your symptoms?
I feel like they're not out of control.
Okay.
But they could be.
Do you feel like they're starting to affect you?
Yeah, they're starting to affect me.
Okay.
More than I would wish.
Yeah. Okay. All right, well that gives me a little bit of an idea of how I can treat you, and I'll definitely talk to some of the doctors here to figure out what really is the best option for you. Our time is running out soon, so I'm just going to write down my contact information.
Okay.
and also the other doctor. So you have our information, and I will go to the office and I will give you a copy of this, and you can, with the receptionist, you can set up an appointment the next time you can meet. We have really flexible hours. We're open from 8:30 a.m. to 4:30 p.m. every day, and we have limited hours on Saturdays. We're closed on Sundays, but whatever works for you. And I'm definitely looking forward to seeing you. And I'll have the psychiatrist give you a call, and you can talk about medication options if that's something you're thinking of doing. It sounds like right now you may not need that. Maybe talking to a therapist would help you enough, gain stability and start feeling normal as you described before. So, yes. And I'm Michelle once again.
Thank you.
So information, and if you come with me, you can walk to the office and I'll make a copy of this for you,
Okay.
and we'll keep this on file just so we both have that. So it's very nice meeting you.
Nice meeting you too.
All right, this way.